Neurologist Rubio from RT3C, and I'm going to perform the sampling and analyzing of arterial blood gases. So first thing we need to do is we need to do the hand washing. This reduces the numbers of microorganisms residing on the surface of our hands. After that, we read the doctor's order. This is to obtain pertinent data, and then we instruct the patient regarding the purposes, procedure, and responsibilities. This information may alleviate hyperventilation. When it is present, it may alter the arterial blood gas values. After that, we select site. So there are three choices of sites. The first choice is the radial artery. So the radial artery is a small artery. However, it is easily to stabilize as it passes through the bone grove of the wrist. The percutaneous puncture and the pressure control is enhanced by the anatomical landmarks. So if we choose the radial artery, we need to perform a Allen's test or modified Allen's test. This collateral circulation provides ulnar artery, and the Allen's test assesses the ulnar artery patency. So in doing the Allen's test, we need to instruct the patient to form a tight fist or raise the arm of the patient above heart level, and then we apply a direct pressure to the radial and ulnar artery to obstruct the arterial blood flow while the patient open and closes fist rapidly for several times. And then we instruct the patient to open fist while the radial artery is compressed. And then we evaluate the palmar surface for erythematous blush or pallor for within 6 seconds. So erythematous blush indicates ulnar artery patency, and this interpreted as positive Allen's test. And while the pallor is an occlusion of the ulnar artery, which this is interpreted as negative Allen's test. So the second choice of site is the brachial artery. Brachial artery is larger than the radial artery. The pressure control after percutaneous puncture is proximity to bone, approximately 1.5 above antecubital fossa. Then the third choice is the femoral artery. So femoral artery is large artery. However, when it is injured, there is no collateral circulation, and this is located proximity to the femoral vein, which it has a potential of false pH, PO2, and PCO2. So next is we position the patient. So for the radial artery puncture, we use a semi-recombinant position. And then elevate and dorsiflex the patient's wrist slightly with a small pillow, and then rotate the patient's hand if the pulse is palpable. So dorsiflexion of the wrist moves the artery above closer to the skin surface, making the arterial easier to palpate. So for brachial artery, we also use a semi-recombinant position. We elevate and hyperextend the patient's arm until pulse is palpable, and then rotate the patient's arm until pulse is also palpable. After that, we now proceed in heparinizing the syringe and needle. To heparinize the syringe and needle, we need to assemble the 22 gauge short bevel needle on the syringe, and then prime the syringe and needle with heparin enough to fill the dead space. And then we eject the air bubbles from the syringe. So the short bevel needle diminishes the risk of overshooting the artery during entry. And then when priming the syringe and heparin, this prevents specimen coagulation, and it is very important to eject all the bubbles to maintain the accuracy of the arterial blood values. After we heparinize this, we prepare the site and the fingers we use to palpate the site. So cleanse the wrist. For example, this is the wrist. First, we cleanse the wrist and cleanse the site in a circular motion outward with Rubio iodine. And then we allow it to dry. After that, when this is dry, we need to cleanse it again with the alcohol swab. Then allow it to dry. So the use of Rubio iodine will prevent local infection, while the alcohol this increase the visibility of the site, which cleanses the coloring of the Rubio iodine. Then it is very important to dry the alcohol site, because the moist alcohol prepared site can increase pain. So after we dry the site, we perform the percutaneous puncture of the selected site. So okay, now we locate first the artery. Then stabilize the artery by pulling a skin taut. And then skin taut. And then we puncture the skin slowly. Above. We puncture the skin slowly. Holding the syringe in a pencil, with the bevel facing upward, approximately 45 to 60 degrees for femoral and radial. For radial and brachial artery, while for femoral 90 degrees is used. after puncturing, after we puncture, we will observe for the syringe to have flashback of the blood. And then if the procedure is unsuccessful, we just need to withdraw the needle above the skin level and then face the bevel or the needle slightly toward. So a slow gradual thrust, slow gradual thrust promotes arterial entry without passing through it, and it is more important the certainty of the position rather than the entry point, and it is pulsation of blood into the syringe is verified if the pulsation of blood through the syringe verifies that the artery has been punctured. After that, we must obtain 1 to 3 ml of specimen. This allows us to recheck and add additional studies if necessary. And then we withdraw the syringe while stabilizing the barrel. We withdraw the needle while stabilizing the barrel of syringe. Then we apply a firm continuous pressure to the arterial puncture for 5 minutes or until the bleeding stops, and or apply 10 minutes if the patient has a history of increased coagulation, or you can use ice pack to decrease the persistent bleeding. So hematoma after percutaneous puncture may cause circulatory impedance, discomfort, or infection. So after that, after applying pressure, we protect the sample. So we need to hold the syringe upright to express the air bubbles. Then we need to seal the needle immediately using the cap or the rubber stopper. And then roll the syringe gently to mix the blood and heparin. Then immerse the blood sample in enough ice for transportation. Then label the specimen and expedite the blood sample to the laboratory services. So the air bubbles may alter the laboratory test results. So it is very important to keep airtight to prevent alteration of the result. And then the use of ice reduces the temperature of the sample to 40 degrees Celsius, and it also slows the metabolism of the oxygen. So the specific information enhances the accuracy of the analysis of results. Then after doing this, we need to take the patient and do the